Hello there, Spinal Health Wellness. Dr. Andrea at our location here at the Birth Center. And today I'm honored to have Kathleen McCarthy join me to talk about the Birth Center. She's a co-owner here of the Birth Center, the Holistic Women's Healthcare, the new facility on Churchman's Road. And it's an honor to have you. Thank you for coming. So let's just really jump right in here because everybody loves to hear the story of the Birth Center and your journey of how you got here and possibly how long you and your business partner, Dorinda, have owned it and what it used to be like down on 7th Street and what it looks like now.
Okay. All right. So I started out as a labor and delivery nurse, and I was a labor and delivery nurse for 15 years at St. Francis Hospital. And one of the things I found as a nurse is that women didn't necessarily get the birth plan they wanted. And it wasn't based on medical reasons. It was based on other reasons. And I felt like if I go to midwifery school and become a midwife, the women under my care could have the birth experience that was their goal, as long as everything was fine. So I went to University of Penn and went to midwifery school there, and then started working as a nurse midwife at St. Francis Hospital. And around the same time, Edie Wallnell, who owned the birth center, retired and sold the practice to St. Francis. So I then started delivering babies in both places. So I had never had this desire to do out a hospital birth because I loved the hospital. They put in tubs so we could do laboring.
Oh, nice.
I had been there for so long. I was used to the culture. I liked having the OR, right down the way. And so my mindset at that time was never out of hospital. And then I started delivering babies out of hospital at the birth center and just was in complete awe with the difference in experience. And I'll give you a little bit about that. So when women or families are laboring and birthing at the birth center, it's really about the couple, and it's the provider's responsibility to make sure everybody's safe, but to support the couple to be empowered in their birth experience.
Nice.
And everything was done based on what their needs are, not based on what the culture of the hospital is. For example, like the baby, because the hospitals are busy, they want to take the baby away right away to measure and do all that stuff just in case somebody else came in. Where there, the babies were, as long as everything was fine, the babies stayed with mom and pop until they were ready to have the baby weighed and so forth like that.
That's beautiful.
So, and I love just the sitting back at a birth and watching a couple support each other, and it's phenomenal. And I also saw him empowered the woman. So that was a big wake up call for me.
So how long has it been now that you and your business partner Dorinda have had the birth center?
Since 1999.
Oh wow.
Yeah, since 1999.
So quite a few babies.
We've had quite a few babies, and
I heard it's up to like close to 5,000, right? It's over 4,000.
It is. Yeah, it is, and it's been a beautiful ride. We've been in the same building at the 1508 West 7th Street until mid-December, and we moved into our new space, which we love, which every birth room has a tub, right? Except for one. 3 of the 4 birth rooms have a tub, and the rooms are spacious and clean and bigger. There's more room to move, to get around, it just feels lighter. And the big piece for us, when we decided to move the birth center, because we were outgrowing our space, it had always been a dream for me to have an integrative center. Because one of the things that I found, and what our families had said, I had put out 4 years ago a questionnaire on Facebook to our clients. What do you want? What do you want to see in the birth center? And they said they want a one-stop shopping kind of a thing, everything within one space, and that the women are treated like we treat them, like they're part of our family.
That's exactly right. It is like a family.
So in the past 3 years, that's been this endeavor. We've vetted people. We've signed people on to come join us in our practice. So there are a lot of independent practices here that are joined together in our space to provide families with the holistic care that I think that they deserve. Typically, prior to this, if we wanted to we introduced integrative medicine, we'd send people out.
Right.
And now we have everything here: chiropractic, Andrea, functional medicine, acupuncture, massage, family practice,
Yeah, that's great.
craniosacral therapy. So now we're going to have healing touch therapy. So there's just a lot of modalities here that help to
that you can
provide women with the care that
yeah.
that I think that they need, and that they have options, right?
Because for so many years, you guys were known as amazing prenatal care and these wonderful birth experiences. And now you've really grown and branched to serve the local community in so many different ways and in one place. How convenient can it be?
Yeah.
That's really nice. I'm honored to be part of that journey.
Well, I'm honored that you're here.
Well, thank you. So if you can share with the people out there maybe a heartwarming story or something that you really remember through the years, the way this became a big family to you and your business partner, what would you say was some of the defining moments, I guess?
So I think when Dorinda and I purchased the birth center in 1999, we had young children, right? So our kids were little. First grade, kindergarten were mine. And they basically grew up at the birth center. So Dorinda and I were always committed to attending our kids' events, being really actively involved in our kids' lives. So that's a model of management that we use with our employees. So we started out in 1999, Dorinda, myself, and Peggy, and a volunteer at the desk and a volunteer doing our billing. Now we have 31 employees. So, and 31 female employees, really. So again, with that same approach that we did, that we want people to enjoy their family and to make events and, have a true balance in their life. That's what we offer to our employees. We want them to have the same thing. So I think that family feel and that support makes the environment a really positive environment to work in. It feels good.
It does.
Yeah.
It's very family oriented.
Yeah.
So if you were to think of the next year here in your new building in this beautiful space that you guys have created, what are some of the things that you see happening, or the events or classes and some of the good changes?
So let me go back and say one more thing about what else do nurse midwives do. So we do full scope care too. So we're doing gynecology from women. We have girls from 14 to 70. So we do the whole spectrum of care. Just as we do with prenatal care and birth, we provide a holistic approach to gynecology and birth control. So I wanted to put that in there. What's coming up in the future is that we have our open house coming up. So that's January 26th.
Just in a week or so. We're going to be open for everyone.
Yeah.
The public, practitioners. Are we going to have a lot of the integrative people here? So you can meet them too, and all the midwives will be around.
Hopefully, some of the midwives will be here.
Good. Yeah. That's nice. And the nurses and excellent.
Yeah.
Excellent.
And so that's coming up. And we already do a lot of classes. So we have a lot of workshops, and we have yoga, and we have mom's group, and we have a slew of childbirth classes.
Yeah. And there's breastfeeding, right? And there's nutrition now, and baby wearing and diapers and really everything, it sounds like.
So we're adding Tai Chi. There's going to be Tai Chi on Tuesday afternoons.
Nice. Perfect for me.
And, I think a big important thing that we're doing that I think will serve families well is that when families choose to do integrative care, one of the things that we found when we sent people over, we didn't get the feedback back. So there wasn't a way of communicating that this is what I've done. This is, so where things are. As integrated practitioners at the birth center, we're committed to create a way in which we are able to inform each other of what the plan is. It's the part of the team. So a family will choose a team, right? Maybe a chiropractor, acupuncture, gynae, or whatever. And then we will come together as a team to do case management to serve our families in the best way we can.
That's great.
Another big piece is
nothing will get dropped then.
Right.
Everybody will really be in communication for the overall of the patient's care.
Yeah.
That's wonderful.
Yeah.
So what else? Let's see. Where can everyone find us? I think I'll be able to put everything down below, but you guys have a great website. You've just uploaded all the classes are on there, right? And all the updates for people can link, I think, to your Facebook page, and you guys have an Instagram following, and there's different upcoming events on there as well. And there's links to different practitioners. So the website's kind of real time. Everything's being brought on as it's going, it seems.
Yes. Yeah.
Good. So the website, we'll have that down below, and we've got it streaming here. And hopefully for the open house now, or if there's not a birth, are we going to be able to see some of those beautiful rooms with the tubs and stuff?
We're going to have, if there's somebody in labor, we're going to streamline. We're going to have video in the classroom.
Oh, beautiful.
Yeah.
So people can still get an idea.
Yeah.
Because you never know when those babies are coming.
You don't.
Well, excellent. So let's see if we can get as many people here to see this beautiful new building on January 26th. And hopefully we'll be able to give you a nice look at the nice birthing tubs. Everybody seems to be giving good feedback on that. They love the rooms and the tubs. And well, congratulations really to you guys. You and Dorinda have created a beautiful family loving environment here. And you got amazing midwives and a fantastic staff. So I just want to wish you guys the best on this next chapter in this endeavor. I'm really blessed to be joining you on it.
And we feel blessed that you're coming you're with us.
Well, thank you. Thank you so much. So make sure you check out the website and get to some of these classes. If you have questions, you can always call the birth center, and the number's listed below. And we look forward to seeing you at the open house here at 620 Churchman's Road, the new location. And thank you so much for your time.
Thank you. That's easy.